I'm assuming they prefer gradual death. Okay, you will get the gradual, slow death. This is a true story. There are few learnings from the story. And for today's topic, the story learning is the sudden death. But there are other learning also, the willpower and all those things. True story. So my father had a heart attack during Corona time. Yeah, the first heart attack. And he underwent angioplasty. That angioplasty did not work. Right? Because we went to the hospital late because of Corona, fear of Corona infection. He was admitted for 1 month. And I was there at the hospital 30 days. Suddenly, my fear of Corona had gone. uh, I don't know. So, but thankfully, I didn't contract it. And by the time he was discharged after 1 month, doctor said that he cannot walk, he cannot climb stairs, and he will be dependent. Okay, because ejection fraction is 20%. Normal ejection fraction of heart is around 45%. So 50% damage is done, right? So maybe 40% heart is functioning now. Okay. So, and we came home. I arranged the ICU at the home, the nurse, the doctor visiting, and all the bed, the monitor, all the oxygen, and all the nebulizer, all those things. Yeah, which son has to supposed to, a doctor son supposed to do. Arrange the ICU, same ICU, because we don't want to stay longer at the hospital. And then one day my father called me and he said that remove all these things. I'm like, what is a plan? Like, what is a plan? Like, do you intend to say goodbye? So I asked him, do you want to say goodbye? I said, no, stupid. I'm feeling better. So and then we removed all those things. Then we had a 2-floor house where he lives, used to live. So he was living at the downstairs, yeah, ground floor. Then after 1 week, he called and said that, yeah, I'm shifting to my room on the first floor. Okay. I'm like, yes, okay. So doctor has said he cannot walk, but my father said he will shift to his own room, downstairs, upstairs, walk the stairs at least 4 times in a day. Because in the morning he has to go for the walk. Yeah, he decided to go for the garden walk, continue for the garden walk. Yeah. So then one time for some office was downstairs, so office work, then sometime else. So 3-4 times daily. Now, few months later, he visited the doctor. Doctor asked, how is your health? He says, I'm fantastic. So, are you still like able to walk? He said, yeah, I'm actually climbing the stairs 4 times in a day and walk 5 kilometers in a day. The doctor is very impressed. Yeah. Then there comes a second heart attack. Now, the second heart attack, the story is that he's alone in the market and suddenly he had probably arrhythmia and he went unconscious. And people are surrounding, you know how it happens in the market. Like people are like, oh, what happened? What happened? Everyone's like, but somehow his phone pocket dialed me. Yeah, I got a pocket dial from my father's call number, and I answered that phone, and I realized there is something wrong. So I always have a protocol that I will always answer few calls, even if I'm in busy. So I realized something wrong. Then I called back that number. And then someone else answered the phone and he said that jinka ye phone hai, the phone who's this person is unconscious and lying at this place. Then I called my brother and said I was in Mumbai that time. So I called my brother and said that you go there, yeah, and try to do CPR and all those things. So CPR done, revived, came back home. And next day we thought, okay, should we visit a doctor? He said, I'm feeling good. Okay. Any chest pain, anything, any problem, any symptoms? Are you able to walk stairs? That is a factor. So are you, how many kilometers you walk today in the garden? 5. Okay, good. No need to go. Forget. Then 2 years pass by. 2 years, huh? So doctor has said 6 months patient will not live. 2 years patient is still walking and going. Now, so this was second. The third heart attack. Now the third attack is again that arrhythmia. So here the risk of sudden death. Yeah, arrhythmia. And now third heart attack was again 1 month we were admitted to hospital. So the doctor says now I think the time has come for the implant. Yeah. So we put the intercostal defibrillator. whatever. Yeah, ICD, intracost. So there is a defibrillator. Normally, what you do when you have arrhythmia, you give a shock externally to the patient. Yeah, but now the patient may be outside. Yeah, the shock you can give at hospital only or homemade ICU. So so there is a device which is implanted near the heart, under the chest muscles. It detects the arrhythmia. If the patient has arrhythmia, it will give the shock. So that device is to be ordered from US. So I said, okay, go ahead, no problem. So they ordered the device and everything and all those things. But my father was weak. Okay. So physically he was weak. So I was okay, everything. And but the doctor said that it's very costly device. I said, sir, I can buy your hospital actually. So don't worry about the cost of the device. Get that device from wherever you want and get the best company. So the device came, and by 11 p.m., I thought, okay, I should do the research on what this surgery is there. Then I saw that, oh, this surgery is a big surgery. Then I called doctor, sir, I want to meet you. Please come now. So he was kind enough to come in the middle of 11 p.m., middle of the night. And he explained me that we are going to open his chest and do this and create a pocket and then put that device. I was like, no, he is not going to tolerate that. Yeah, and the doctor is like, no, 1 week in the hospital, 1 month at home care in your home ICU, homemade ICU, and he will be good. I said, no, 1 month can be 3 months also bedridden. No, I will choose sudden death. See, life and death, they are already written. So 6 months after this episode, he went away. He departed. My father passed away. If I would have gone for that implant, it would have been a gradual death. He would have been bedridden for 3 months, 4 months, probably 6 months, dependent. Yeah. And this defibrillator, what would have done? It would have probably just prevented arrhythmia or treated arrhythmia. But inherent disease is there. Yeah. Heart is not functioning, heart failure is there. Many things. Old age is there, 72, 74 now. So I decided, I told the doctor, I would prefer a sudden death for my father. He said, we have not seen any son talking like this. Yeah, people get emotional. They sell their jewelry, they sell their lands to save their old parents, and the parents then die and they don't have anything. I said, no, it's not about the money. Obviously, you also know me. It's about what kind of life you want to give to your parents. What kind of life I would prefer for me. Yeah? So I prefer sudden death for my father. Then I went to my father and told him that I have decided on this. My father said, okay. And then one day, after 6 months, I got a call, father passed away, sudden death. So the day he passed away, he went to the garden, he met his friends, he went to buy vegetables, he climbed downstairs. He was not bedridden in his room or downstairs room for one day also. Probably ICD may have extended life by 1 month or 2 months. But if you consider life and death, they are written when it was not extension. Yeah, that's not the quality of life you want. Sometimes some clients call me and they ask the opinion that, sir, 72, 70 age parents, they have been diagnosed with cancer, blood cancer. What should we do? They are trying for everything. They spend money. Yeah. They do some test, fish test, that test, that test. And they try to find out that what is the type of blood cancer is there? What is the objective? You spend 1 lakh rupee just to find out a diagnosis. Yeah. What is the objective? Then you will start chemo, that 72-year person. And this chemo can itself kill him or her. And people sell their house, gold, everything, all savings. No, the correct decision is to bring that patient home. Say goodbye at home. It will take 15 days, 20 days, 1 month. But the patient will not die of the guilt. That patient consumed the whole property of the family and died. The death is imminent. With any medicine, any treatment, you can extend it by 6 months to 1 year. The time has come to prepare yourself for the death. Come home, say goodbye. This is a true story again. Huh? Now the difficulty comes when someone is young. I had one of my employee, 35 years, a female, she developed blood cancer, acute lymphocytic leukemia. Husband came to me, she was on leave. Husband came to me, asked for some money. I gave 50, 60,000 because that was their expense for diagnosis. So confirm the diagnosis, that is important. Husband came to me with the report. Asked me, sir, what should I do? I said, my company medical insurance will cover 5 lakhs. You will have another expense of around 15, 20 lakhs. And she will die a painful death in next 1.5 years, 2 years. With all the chemo, all the harassment you are going to do, take her to Mumbai, take her to this, take her to this place, take her to that place. What do you want to do? She had a child. Nothing can be done. Now he was like, sir, I will sell the house and all. So I said, that is your choice. But you have to think that will not prolong her life beyond certain point. 1 year, 1.5 years, 2 years. The tough decision you will have to take. Whether to say goodbye at home or to spend all your earnings and make her painful death. And she will die of the guilt that she destabilized you financially before death. So that is a tough. Yeah, if it is old age, the choice is very easy. It's not being about heartless or with heart. It's not about being emotions or practical. It's about what is best for the quality of life. If you control your diabetes, your quality of life will be better. That's the only thing. The last 5 years, last 3 years will be better for you. Hey, you are going to die at the age of 65, 70 or whatever. But last 5 years, do you want to live with brain stroke, heart disease, kidney failure, that failure and all those things? Or you want to delay it and just suffer last 2 years? Suffering is there. You want to reduce it or you want to enjoy it? Now, whenever you lose some, especially your parents, the grief is there. I was mentally prepared since 2 years because I was mentally prepared. I prepared my family that father may go anytime. We are selected sudden death. So 2 years, anytime he can go. But the death, it causes the grief. When I went under grief, went under breakdown, mental breakdown. Yeah. So then that time in psychotherapy sessions, in Sunday classes, I used to teach certain methods for grief counseling, certain methods to overcome the grief. And I used to say that this is sufficient. But then I realized, no, this is not sufficient. Not sufficient. So there needs some new methods, new research in this. So that's why I am funding a research on grief counseling. You can check the details in griefcounselor.in or griefcounseling.in. Both are the websites for that. Okay. You can check this. So more than 10 hospitals, now more than 15 hospitals, they have participated in this.